Okay, thank you, Mark Levine, and thanks to the county executives for taking a few minutes in their busy schedule, and thanks to the members of the media. And thanks to everybody collectively for joining us and taking a few minutes to give a quick update on things happening in the counties. There are many issues facing the counties right now. We wanted to take this opportunity to make some brief statements today. The New York State Association of Counties, on behalf of New York's 57 counties, will present state budget testimony to the State Senate and the Assembly local government fiscal committees. As it does every year, the state budget will have a direct impact on our counties and local taxpayers. This week, as has been reported, the United States House and the Senate began negotiations on a federal stimulus package that provides funding for counties and local governments. Both of these spending plans will have a direct and immediate impact on county governments across the state. Before I move on, I did want to acknowledge and thank Senator Gillibrand, the New York congressional delegation, in a bipartisan manner for their steadfast leadership and calling for funding for local government, and of course recognize the great Senate Majority Leader Chuck Schumer for his leadership in bringing the Senate together to make this package happen. For nearly a year now, counties, almost a full year, have been working tirelessly to secure direct federal aid to offset losses in revenue and state cuts associated with the global coronavirus pandemic. The counties have been asking for this fiscal relief, and we're hopeful that this package of relief will provide some important aid to New York's counties. I wanted to give a quick update of what we know to be true about the federal stimulus program. The state of New York is targeted at this time to receive about or approximately $12.6 billion. The 57 counties of New York are targeted around $2.2 billion. The city of New York around $5.8 billion. And then all other local governments through a formula known as the Community Develop Block Grant will be receiving $3.4 billion. So the hundreds, if not thousands, other local governments in the state of New York will collectively receive $3.4 billion. It's important to note that this is not just for lost revenue. This stimulus package is different and is targeted toward rather a different approach of rebuilding the entire economy of the United States, and in the state of New York in particular, in the post-COVID era. The use of funds, so far we understand, is to respond to or mitigate the impact of COVID or the COVID pandemic or its economic consequences in the communities of New York. 2, to cover the costs stemming from the public health emergency. 3, replace lost revenues such as sales tax, hotel, motel, occupancy taxes, or property taxes, or any delayed revenues or decreased revenues identified by the state or the local governments, and to furthermore address negative consequences of the economic impact of the emergency. When I stop and think about the role of county governments, if I take a typical county like Dutchess, but this applies to everybody on the call, there's, of course, the county executive, the legislature, the district attorney, the election commissioners, the sheriff, the budget officer, children with special needs department, community and family services, the community college, the coroner, the division of veteran services, division of youth services, the real property department, the public health department, the public works department, the mental health and substance abuse department, the office for the aging, just to name a few. All of these agencies have been affected by COVID, and all of these agencies need to collectively rebuild the local economy, and that's why this federal stimulus program is very important to the counties. The last thing I'll say is today we'll be submitting budget testimony in response to the governor's budget. We're going to focus on 2 things: a pause or a delay on the county's sales tax diversion, which was included in last year's state budget, and we're asking this because the hospital and healthcare industry received over $10 billion of federal investment from the prior COVID stimulus programs, and we feel that that's not necessary now to divert the local sales tax for a distressed hospital fund. 2, We're asking the legislature to restore the 5% cuts across the board, which impact the counties of about $160 million. And the last thing I'll mention is we've asked the governor to put language into the state budget that would allow the sales tax to be collected on vacation rentals through programs such as Airbnb. And we're hopeful that that could generate upwards of $10 million to the state and the local governments. We are going to ask the legislature to modify that provision to have that collection be applicable only to the counties outside of New York City. So with that said, we'll get copies of that testimony out to the media later in the day. I want to recognize and I truly want to thank County Executive Mark Molinaro for all he does to keep our state united and leading the great Association of County Executives. The Dutchess County Executive, Mark Molinaro.
Thank you, Steve. Thanks all of you for joining today, and to the members of the media. You are joined by really, I think, the hardest working group of elected officials in the state of New York. Certainly these last 12 months, you recognize the county governments have been really the arm of action, if you will, where our responsibility has been to respond to this pandemic. And as rules change from Washington and Albany, as the variables change and we learn more about the virus, and of course, the hope, if you will, the light at the end of the tunnel becomes clearer with the distribution of vaccines. It is, in fact, and it remains county governments that are the action arm of local government, and I think, quite frankly, of government during this pandemic in the state. We want to touch on, as Steve mentioned, just a couple items and then open up for questions. First, Steve will represent the county governments across the state in making testimony before the state legislature. You've heard what are our concerns. I will say this, I certainly have been around in local elected office for a while, since 1994. I've been in county government on and off for the last decade and a half, not as long as Tony Pacenti from Oneida County, but nevertheless, we have experienced worse state budgets than this. And I think that is a fair representation of what we see from the governor's office. This is not the most challenging of state budgets if the cuts don't get deeper. And I think we want to start there. That we believe that there are just several small actions needed by the state legislature. One is a matter of fairness and equity, and that is to pause the raid of local sales tax. Keep in mind that county governments collect sales tax all across the state. Most counties share that sales tax with cities and towns within their communities. The state, for the first time ever, raiding the local sales tax for a non-governmental local government purpose. Those dollars through the Distress Hospital Fund amount to millions upon millions of sales tax dollars that ordinarily would remain with county governments and share those dollars with towns, villages, and cities. We're asking for a pause of that raid. Why? Well, one, it's just simply not fair nor responsible. Most counties don't or even have a distressed hospital that would be benefiting from this. Second, we don't know yet necessarily yet how the state intends to use those dollars. But thirdly, I think most importantly, those very hospitals, and we acknowledge the stress on the hospital system, have benefited from a significant infusion of federal aid. And that federal aid is really what ought to be made available to those hospitals struggling, not sales tax taken from already challenged county governments. So that for us is a major concern. We hope the state legislature will dial that back and give a pause so that we can continue to get back on our feet and provide those core services that Steve mentioned you all know that we respond to. We also want to just reference, of course, the federal relief package. We are tremendously grateful to Senator Schumer. He has been, without question, steadfast in his support of direct aid to local governments. And despite what you might hear otherwise, and I'll be very candid, we do not believe that every dollar of aid should flow through Albany. We've never believed it. We don't believe it now, and we don't think it is necessary or responsible. There are state needs, and the state government ought to negotiate those with federal leaders. But there are county and local government needs that will never be met financially by the state of New York, and maybe shouldn't be. The federal government does have a responsibility to provide assistance to its local government partners, and Senator Schumer and our delegation across the state of New York have made clear that direct aid to local governments is a necessity. those dollars not stopping at on go, not paying $200 on its way around the monopoly board, instead coming directly to county governments means that it is direct and it will get to the people who need it most. And we believe that that is a critical component of the federal government's relief package. We support it. We're grateful for it. And we're going to continue to advocate for it. County governments have seen seismic losses in sales tax revenue. We've had to take on important responsibilities that we take seriously, but have added cost to the administration of county government. We believe that direct aid is critical, necessary, and we're grateful that Senator Schumer and our congressional delegation remain committed to it. Lastly, and we'll open up certainly to questions about it, I would say that the needle has moved slightly on vaccine distribution. The recognition, I think, over the course of the last 7 days, I'd say, that county governments are a critical partner in the distribution of vaccines, at the very least, is starting to be said aloud in Albany. And frankly, if we can have the doses that we expect redirected from hospitals to county governments, it would give us a broader ability to get vaccines in the arms of residents. We still, however, remain somewhat sidelined, and we're going to continue to advocate for that, for the role that taxpayers across the state of New York have expected of us. We are mandated to create vaccine distribution plans. We are prepared to vaccinate across our communities, and we can do it in a way that is effective and equitable, and the state acknowledging that and then ultimately providing us the doses and the support to do that, I think is in the best interest of anyone and everyone. So Steve, if you would, I think, I don't know if any of my colleagues want to jump in at this moment. Based on what I heard, most are comfortable answering questions, but I'll leave that to the NYSAC staff. But I would note our goal today is to take your questions, and we'll take as many as we can get through, and want to give you the information as best we can. So thanks for participating.
Thank you, President Molinaro. Do any of the county executives, would any of the county executives like to make some brief remarks before we take some questions from the media?
Let's jump on in.
Okay, Mark Levine, you want to see if there's questions from our media partners?
Hearing none from the county executives, we have John Campbell from the Gannett USA Today. John, you can unmute your microphone. Thank you.
Hi, everybody. My question, and I've talked with some people about this, but I'm want to get some clarification on how county executives are learning where the vaccination clinics and pharmacies, et cetera, are in your area. Are you getting that directly from the state? Are you getting it from your regional vaccination hub? Is it different in different areas of the state? I'm looking for some insight on that.
I'm going to ask Ed Day to jump in from the Mid-Hudson region if he wants, and then maybe Steve, we can jump around to some other regions. Ed has a perspective that I think is representative of our region.
I would like to think so. We've spoken about this enough already. John, to your question, up until very recently, the place we found out where those doses were places like Gannett News and the various outlets that are printing. And also we heard from people calling us and letting us know that a certain pharmacy had vaccines. We did not know at all. And that is, again, part of the issue that Marcus was speaking to. We are hopeful there'll be an improvement in the communication and a more of a joint effort here, because with all due respect to state government, it is the counties that have the expertise in the health departments. It is the counties who've been through this before. It's the counties who train for this. And in this particular case in Rockland County was one of the two worst places during the measles epidemic. We did this. So on top of having the same training that all my fellow county executives health departments have, we actually done this. We administered over 30,000 MMRs during that pandemic, and we got that done. And I'm very proud of the fact that we're 5 days away from losing our measles-free status worldwide as a nation, and we prevented that. So that's what counties can do, given the chance. So I'm hopeful we see an improvement now going forward, that we will know exactly what's going on, because this operating darkness is not a good thing for anybody. Thank you, Mark.
Tony, I know Tony Pacenti wanted to jump in.
Yeah, thank you, Mark, and Ed, and to all my colleagues, and Steve Acquario, of course. Thank you for the opportunity. So just to play on what Ed said, I mean, just recently, and actually what President Molinaro said, just recently we've been clued in. But I think it's important, and I don't know if, and I hadn't talked to Mark in the last day or so, but in the last 2 weeks we have gotten notification of the amount of doses sent to various areas in pharmacies, hospitals, and certainly county government. We have not been told, at least I have not been told, how many doses are going to the state pod that's run in my area. And I've asked repeatedly, and I still don't know, because those have never closed. I think it's important. Those have never closed down in the last 3 or 4 weeks here, where we have closed down because we don't have enough. So while it, as Mark said, it's been loosening up a little bit more, and hopefully, if we're going to do next week with comorbidities, being added to the listing here, that those dosages will increase, and they need to increase substantially. It just can't be this, 20%. They made a big deal about 20%. 20%, I got 500 the week before, so 20% was 100 more. That's 600. So while 20% sounds like a lot, when you're only getting 500 doses, it's not. So, I mean, the other point is to that question, John, it's, we know what everybody's getting, at least we've been the last few days, the last 2 weeks maybe. Don't know what they're getting or what they're using, which is not, let's be transparent here. Let's stop this.
Thank you, Tony.
If there are other county executives that would like to answer the question, please, you can unmute at any time and answer. If we have no, okay, Chris Moss and PJ Wendell. Chris Moss, please. Chautauqua County Executive.
Thank you. Just real quick, we had to request it to probably about, it took 2 or 3 weeks. We've been getting the information after we requested it. And one of the things that we found is that our local pharmacies were getting more doses than our local health department. So then we made the inquiry with the state. 1 week, our local pharmacies got 600 doses. Our local health department got 200. And, we found out from people calling, hey, how do I get into this pharmacy or that pharmacy? So the communication has to be a lot better. And we're also concerned with the state facility set up 2 counties away. My residents have to get in the car, drive for an hour one way to get vaccinated, when we have multiple locations here that the county set up in pods at the request of the state. But unfortunately, we have no vaccination to keep the pods open. So better communication and a better distribution is definitely necessary. Thank you.
Thank you. That was Chemung County Executive Chris Moss and Chautauqua County Executive PJ Wendell.
Yeah, thanks everybody, Steve and NYSAC and Mark, for your leadership for our organization. Just to touch on it, we're kind of in a cloud sometimes with our information and what we are able to get. My county, we were ready for a state hub. We were told the state hub was not going to open based on a lack of vaccine. Well, I have residents that are traveling as far away as Syracuse to get a vaccine from a state hub. We do, but we still have, we recently got the allocations, but prior to that we had to ask. And, I have a weekly, or actually bi-weekly meetings with our hospitals, and they've all said, this isn't our wheelhouse. We'll do it. We can get it done. But we all agree that the counties, Ed Day spoke perfectly about this. This is where it's at. That's where the rubber meets the road. The state was giving $450 million, I believe, for vaccine distribution, 113 on hand, and we're paying astronomical amounts for these state hubs. The money needs to be distributed to local municipalities and local counties. Their health departments are experts. Let them do it. Let them use the money efficiently. We know how to do that, and get us the vaccines we need. That's, I had a very reassuring call yesterday that micromanaging is going to be limited in this. I'm waiting to see if that's really going to happen. We need more communication. We need to be given the power to do this effectively. As we've all said, our health departments can do this.
Stephen Acquario, do you have a comment on this question?
Yeah, just a quick comment to John Campbell with Gannett. We have asked for as we enter the comorbidity population, which becomes eligible 15th of February, to have a better understanding of the current providers that are approved to administer the vaccine, so that the county, a local health department, can coordinate and work with and through these partners on making the vaccine administered through currently eligible and approved providers by the state. There are 5,000 of them across the state, and the counties at present do not know within their county jurisdictions all of the providers which are eligible. So we are asking the state to provide that information. This week we were given some information regarding those providers which had already pre-booked vaccinations. So that is helpful. That is a step in the right direction. The counties were given the information of which providers pre-booked, so that we can understand those providers and work together. So I did want to add that. Thank you, Mark Levine.
Our next question comes from Morgan Mackay from Spectrum News. Morgan, can you unmute your line, please?
Hey guys, thank you for taking my questions. Since we are on the vaccines, I've heard the state MATS vaccination sites are pulling doses away from local pharmacies and local hubs. Is there truth to these reports? And two more questions for you guys. What sort of cuts are your governments experiencing due to these state withholdings? I know in Albany, they were providing incentives to encourage people to retire. Are moves like this still happening? And third, is there a push, and will there be a push from county executives to lawmakers to limit the governor's emergency powers? Thank you.
So why don't I take a stab at least number one and number three. I can manage that. Every county probably would offer some concept on what cuts they've had to make, and all have had to do that. But keep in mind, we're all making reductions. In my county's case, we initiated an early retirement incentive, 103 positions that either are being left unfunded or were eliminated entirely, while also taking on millions of dollars worth of new expense to manage this responsibility, which none of us complain about. We have that responsibility, we get it. On the issue of cannibalizing vaccine allotments, I mean, the short answer is yes, that is occurring. What we have seen and actually saw before the state sites opened was an equitable at least the best what we could tell, an equitable distribution of doses across the state. That was week 1 and 2. In week 3 of vaccine distribution, they began opening these locations, and again, they may be no more local to a county than Binghamton is Dutchess. Just keep that in mind. The fact that they are in quotes regional doesn't necessarily make them accessible. They're just locations within each region. The state is directing thousands of doses. In the Mid-Hudson region, that's about 7,000 doses a week go to the county center in Westchester for distribution. I'd argue we have seen in our region, Ed Day could affirm it, but we've seen in our region the dose distribution by percentage and the numbers of individuals vaccinated by percentage. It seems to us that, and it's just not their fault, and certainly not a slight, but the residents of Westchester have a higher percentage of vaccination than, let's say, the residents of Ulster because of the lack of proximity. The reason that, and so thousands of doses are being cannibalized and redirected to the state sites from everyone else. And we wouldn't argue only that pharmacies and the local health departments deserve access. They've limited direct distribution to federally qualified healthcare clinics, which are required to provide access to those who might not have the means or the access to healthcare. Many of those, of course, support Black and brown communities. So those are the points of contact that would be certainly able to distribute, and yes, they're being limited. They're also being limited to doctors' offices. As we prepare for vaccinating and opening up some capacity to those with comorbidities, keep in mind, as Tony Pacenti said, most counties will see an increase, but even a 100% increase in the amount of doses the local health departments distribute is still only a drop in the bucket, from 500 to 1,000 in his case, from 700 to 1,400 in my case, perhaps. That is not, those are not thousands upon thousands of doses. And we would argue that those who are homebound and those with disabilities will never get to any location. So why not take a small percentage of those getting to the state regional sites and get them in the hands of local health departments like ours, so we can we can better and more equitably distribute them. I won't speak for everyone because the association hasn't taken a position on this, but I will offer to you, I think it is general consensus that the time has come that the state legislature restore the balance between the executive and legislative branch, and that we restore the balance between state and local government. You know, there's a reason why during an emergency, in the initial stages, you centralize decision-making. We understand that. We do it ourselves, so we can coordinate the response. But once that initial action is taken, you then relieve that power, that structure, and you empower your partners in a military operation, which of course I've never served, but I know that others have. You're going to empower your field generals. You're going to empower the units on the ground to start making decisions. We've long passed the time at which the control that is centralized around the governor needs to be restored, if only for accountability. But beyond that, beyond just accountability, as now every week we get some new, I'll say, offhanded change in rules. Yesterday, it's now 10% attendance at convention centers. I'm sure that we'll see the science that supports that, he says. But that said, as we started to move from the command and control of the early part of this pandemic and emergency response, you would obviously restore some balance between those who work, let's say, in a capital somewhat isolated from communities. You'd start to restore that operating and operational power to the people on the ground who are doing the task you've asked of them. So yes, the time has come. The state legislature ought to restore that balance between them and the executive branch. And there needs to be a restoration of authority between Albany and local governments. Not total chaos, not total hands off, but absolutely a restoration of that balance. It is just no longer appropriate. And quite frankly, it's corrupting. And I don't mean that in a criminal sense. It's corrupting. It's just not the way you would operate a government in the time of rebuilding. Now is the time to restore that balance so that we can get about doing the work that we're expected to, we're constitutionally mandated to, and that Albany and the governor expect we do. Perhaps,
Thank you.
I don't know if Jason Garner, I don't want to put anyone on the spot, but Jason Garner or Dan McCoy may want to talk maybe about budget cuts and some of the issues you've had to address.
Can I build on the question?
I can talk a little bit about that. I mean,
Ed, we'll go to, let me get to Jason and
okay,
then
got it.
In the county, we've got about 2,000 full-time and part-time positions to mitigate the issues with our sales tax being down and state withholdings. We probably, at one point in time, because of our hiring freeze, we had 300 plus open positions that we didn't fill. We've had to delay millions of dollars of capital projects, and probably the other sizable cut is we've probably had to reduce our funding to contract agencies this year by 50%, and we had to cut our community college contribution by a pretty significant amount as well.
Thank you, Jason. Ed, you wanted to jump in.
Yeah, just real quick to the questions that Morgan asked. Number one, I too also believe, even accepting the governor's staff's numbers on how the percentages that have been given out, total vaccines disseminated to various regions. The fact of the matter is, I'm going to call upon the governor here to use his own words, follow the data, follow the science. And we're looking for equity. Well, we are, in Rockland County, we are a community in need. And I would look very simply at two things. We have 11% of our population is tested positive, and we are number 2 in fatalities per 10,000 in the entire state of New York. So we have a need here, and we should be getting assisted in that manner. The other issue that was touched upon by Marcus, I agree 100%. There was a need early on for this type of approach, a strict command and control approach. And I've always said that the governor did an admirable job in putting this together. I think not having, you had a completely unknown situation by and large. So he did a good job there. But that plan, that phase 1 through 4 plan, was a reopening plan. We have not reopened. The reopening was supposed to be done by July 7th. We had businesses that were borrowing money and taking loans to get to July 7th so they didn't go back to work on July 8th. and the rugs were pulled out from under them. There is absolutely not one reason in this God's earth that this needs to be continuing this way. The decisions being made now, whether it be weddings, that somehow people are going to get tested before going to a wedding, which is absolutely comical, where these numbers are coming from as far as the data and science, because they're not. The Buffalo Bills plan is not data and science. That's anecdotal. That's what that is. Every decision you are seeing now, just stop and think for a second and say, could that not be made by the health department? Could that not be made by the county executives or the mayors? The vast majority of things that are on the Emmy Award TV show are things that are routine within the structure of state and county government. No more and no less. So I agree 100%. The time has come where we do not need that kind of central control. And again, to reemphasize what Mark said, you do not win a war from a bunker in Albany and having your troops and your field generals 200, 300 miles away. It is doomed to failure, and that's one of the reasons why we're having such difficulty in trying to get things through, especially with the lack of communication that my colleagues have all mentioned. Thank you.
If you have a question, please raise your hand or type it into the chat box, please.
I think PJ wanted to jump in. PJ, if you want, go ahead. Well,
Yeah,
we'll wait for another question.
You know, I guess I'll say we were very fortunate. I've got a great team around me. We made budget cuts and significant cuts back in April and May of last year. We furloughed over 130 employees. We made cuts to our budgets. And like Jason said, where we're reducing our funding are areas like our assistance to lake maintenance. We have Chautauqua Lake, 23 miles of beautiful state-owned lake that we are constantly having to fund from local entities, local homeowners, the county, et cetera, with very little over the years to help us. So those cuts were made and we've been okay. You know, we're not in the dire straits that everybody else is. So hats off to my team for that. But, you know, the point of leadership, you know, we all know as leaders here, you know, the best way and the best leadership is empowering those underneath you, as we've all said. So I'm really reiterating statements that are made. I command the farthest outpost from Albany, 353 miles from the county, from the state seat. I can get to Ohio and Pennsylvania before I can get to Albany in their state capital. So having said that, you know, I agree that we need to have a little bit more autonomy here with the decision-making process. We need to give the power back to the local governments and moving things forward. You know, it's evident in what we're seeing. Micromanaging the situation does not help. And, you know, we've heard this before in the press conferences. You know, a statement will be made, you know, and when we come, and I've said it, you know, in our control room with Lieutenant Governor Hochul, you know, present, who's been a huge asset to my administration. But, you know, the statement is, well, the governor, that was a generalized statement. Well, you can't make a generalized statement when you have a county of 130,000 people listening to the governor saying Western New York hasn't felt the pain of COVID, because we kept our numbers down. So, you know, again, the leadership needs to return, you know, back in its appropriate places. We need to have that balance of power. And it's significant in order for us to, as I think Marcus said, to rebuild and come out of this in an effective manner to do the best for our citizens.
At this time, I would like to call on Stephen Acquario.
Okay, Mark, thank you to the county executives. Just to conclude, I wanted to make a statement about why the stimulus program and the direct funding from the federal government to the local governments, in this particular case, the counties, is that important. This is not just about lost revenue, but it's about the federal government rebuilding the entire United States economy in the post-COVID era. That's what they're trying to accomplish. The county governments are the best units of regional government and local government to innovate. That's what the Congress wants to see. They want to see innovation in an economy. They want to see counties working through community college. There's only one official at the local government level that can convene all of the school superintendents, which cross boundaries. There's only one official that can convene all the chief executives of the hospitals within a county. There's only one chief executive that can convene all the long-term care facilities or all the chambers of commerce of all the Main Street businesses that cross lines. That's the county. The federal government wants wants to see the innovation and rebuilding of skills in healthcare and public safety and veteran services across lines all across the counties of America. And so we're very grateful for the work of Senator Chuck Schumer, the New York congressional delegation, to really drive this funding directly to county governments so that we can put it to work quickly and get it out most efficiently to those in need. So with that said, Mark Molinaro, I'll give you a last word to conclude things.
Sure. Just again to reinforce, great societies don't spend money; they invest money. And what Senator Schumer and the congressional delegation is attempting to do is invest some of those federal resources in the action of local governments. We are the arm of action when it comes to government service. We are the tool that one would use to effectively get those dollars on the ground and into the hands of organizations, businesses, and local governments to truly make a difference. Not only to rebuild, but to restore. Not only to restore, but to sort of reinvent the way in which we have to deliver services, the way in which we'll confront economic recovery. That is critical. And I just as county governments were the arm of action when it came to setting up testing sites. And yes, vaccine points of distribution, just as we were the ones to implement contact tracing, just as we're the conduit between the federal government and local businesses for the distribution of PPP, just as we were the point of contact for individuals who are struggling to get through the state's unemployment system, we are that conduit, that mechanism to get dollars on the ground, and we're committed to it. We don't take 10% off the top. We don't collar it and make it run through some bureaucratic system. We simply work with our partners and get the job done. And so that commitment from the federal government is critical. As Steve prepares to present today, it is equally critical that Albany not take steps further to balance any budgetary problems on the backs of county governments, thus the most struggling members of the community. Remember, county governments are the arm of government that provides assistance, social services assistance. We respond to child abuse, domestic violence. We're the ones providing access to higher education through community colleges. The most struggling in our community rely on a service that we may be mandated to provide, but a service nevertheless provided by county government. Further pushing the burden onto local governments only means those who struggle the hardest are the ones that are going to get hit the worst, and that's just not necessary. So we're asking for that pause in the distressed hospital fund. We're asking, and again, acknowledging that the executive's budget, the governor's budget, certainly we've seen worse, and this is a great starting point, and we're grateful, and certainly we welcome that. And then lastly, we seek continued coordination with local governments. As Tony Pacenti was talking briefly before, not only are we struggling to get the information, but keep in mind that we can't even schedule vaccine appointments until we get the doses in hand. And if there's no continuity, if there's no collaboration in that regard, it's difficult to plan and prepare for the days, weeks, let alone months ahead. And so sharing of that data, I think every county in the state would like to see more data. We started to see more in the Mid-Hudson region. Where are the vaccines going? Who's getting them? What's the demographic distribution so we can focus resources to get individuals who need access to vaccines vaccinated? Again, sharing of the distribution so that we can more effectively get shots in the arms. And I conclude by saying, every county in this state spent the last 12 months doing its job, hoping for this moment, that there would be a light at the end of the tunnel, that a vaccine would be distributed, that we could begin to restore sort of normalcy, that we could get back on our feet again. To have that responsibility sidelined, to take the best and the boldest of players and keep them on the bench. I mean, I'd offer, maybe in the case of Ed Day or Jason Garner, this would be like keeping Tom Brady on the bench during a Super Bowl. You wouldn't do it. You take your best and brightest and boldest players and you put them on the field. Right now, we are on the field to play. And right now, county governments need to be off the bench, effectively engaged in bringing vaccines and thus hope and opportunity to people who want it. And that's our message. We thank you for participating. And as always, we thank the staff. And of course, Steve Acquario at NYSAC for keeping us focused, keeping us supported, and keeping the message going. Thanks, everybody.
Thank you, County Executive Molinaro. This will conclude our press conference this morning. NYSAC is recording this and will make it available to the media as soon as it is completed. Thank you.